In the past year, there's been quite a bit of activity. So Crotched Mountain Community Care is an independent case management agency that's statewide in New Hampshire, and we service approximately 800 to 900 clients throughout the state. And there's been a lot of activity as far as rolling out phase 2 of managed care in the state of New Hampshire. So Crotched Mountain Community Care has taken the lead for independent case management in the state, sitting on the Governor's Commission for the 553B bill, or 553 bill, now law, to roll out managed care for long-term supports. MCG and having an electronic health record and using utilization review process flows has really positioned us well to take that lead. We also won the award this year on developing levels of care within MCG's customized guideline module. So we're able to help in preparing for rate setting in the state for independent case management. We've been working with MCG for interoperability, and we've also been part of a statewide grant through the New Hampshire Health Information Organization to connect with a certain amount of providers according to the grant through a pay-agnostic web-based system, so that we can share what's called the CCDA documentation, which is really standardized documentation that can be sent over HIPAA-compliant back and forth, sending and receiving to facilities. And there's a lot of importance in that with the DSRIP program in the state. MCG's worked with us. We took the guideline modification module and we literally built it from scratch. So we used the functionality, but we didn't adapt any content from any evidence-based guidelines from MCG, which is typically what people tend to do. We used an integrated case management module, or an integrated case management model of care that's taught by the Case Management Society of America. And we built that program into MCG, along with other things, NCQA accrediting body, information we put in there, requirements from the state of New Hampshire under the Choices for Independence waiver, Medicaid waiver for funding. We built those into the system. We use Lean Six Sigma analytical tools, and we built those into the system. State and national and federal criteria we built into the system. And we looked at a lot of other resources, such as the multiple data sets for long-term care, the OASIS for home care, which are assessment tools, and we adapted those to our area of practice because nothing really existed that was robust to go in and have an actual electronic health record where you document it according to standard of practice for case management. So that's basically what we built. And then in addition to that, we were able to pull in any of the 17,000 plus MCG evidence-based guidelines into our guidelines on top of that, and then reference those. Mm-hmm. We also had the ability to customize evidence-based work that was being done in other areas in the state through the DSRIP program, so we could have uniformity and kind of align with what they're doing as well and referencing the same tools. So we've done a lot of work to adapt MCG to the environment in the state of New Hampshire for managed care and for the DSRIP program, as well as for our own practice, evidence-based practice. We actually have point of care, we have mobile devices, and we have home offices, and we're able to actually dictate our notes into MCG versus typing for efficiency. So our staff is not out on laptops and typing on a computer, and we can involve the client and the families in that care planning as well as we're dictating, and we're doing a person-centered care plan, which is really interesting. But then this paperwork here is kind of our next step. And the next step for us was and we are looking at a product to provide telemedicine in the home. So now that we have the capability that we do with MCG, we're now in a position where we can deal with enhanced care coordination and transitions for high-risk populations. And because we can stratify our clients from high-level acuity to low-level acuity, we can focus on those high-level acuity clients We can look at our integrated case management program, which is really connecting primary care with behavioral health specialists to prevent unnecessary admissions to the hospital.